Let's have a look at another example, and this is in another of the key actions. Expectations about behaviour are met. The SSA adopts a member protection policy and code of conduct that is available on their website, so everyone will be required to complete that part. The SSA adopts necessary complaints and disciplinary policies and procedures, which are also available on the SSA website. Again, that'll be a general action that all SSAs will be required to implement. Looking perhaps now more specifically at a priority population, and if we took women and girls as the example, which is on the far right hand of your screen, state sporting association staff and volunteers, coaches, etc., provided with inclusive guidelines about communicating with people, in particular looking at women and girls. So participation project. This is the sort of stuff that many state sporting associations will be very familiar with and very comfortable with. This is about active engagement. And there's a range of different ways in which participation can be brought about. It can either be in the directly physical sense, whereby people are participating on game day, trainings, etc. Or it could be coaching and officiating. It could be shown through leadership, and that is in a wide range of ways, whether that's as a volunteer, on the field, through awards. It could also be through administration or good governance, and many of the state sporting associations that were at Vic Health Let's Get Moving Symposium on the 10th of February would have heard some fantastic speakers from Vic Sport, Football Federation, Victoria and Leisure Networks about the importance of organisational change and moving away from a homogenous governance structure and embracing diversity. So what will you need to complete if you're focusing in on Area 1, priority populations? You'll need to complete an application form. You'll need to complete the milestones template of Everyone Wins. You'll also need to complete the milestones template for the participation program. You'll need to have a look at the budget template and fill that in, specifically related to priority populations, and the attached documents which are prescribed in the guidelines. So let's have a look at what a participation program example could be for disability. Working from year 1 through to year 3, you'll be required to consider the planning, how you're going to implement it, the likely participant numbers, and how you're going to monitor and evaluate the success or otherwise of the project. What are the key stakeholders that will be needed throughout the various years to achieve your aims and objectives? And consider some of the key risks that might derail you throughout that journey. The Everyone Wins example, so if again we look at disability here, Champions of Change are active is the key action area here, and the standard is that SSAs recognise as exemplary champions of change. So this will be done over a 3-year period, which is indicated there by those crosses. The planning will be to create 2 new annual awards for individuals that recognise exemplary champions of change at the club and state level. And the implementation will be to create an award criteria in consultation with the active disability agencies and other key partners. To monitor, we're going to seek feedback about the award via SurveyMonkey, and a number of nominations we'll receive will also be part of the evaluation findings. Some of the critical stakeholders are active disability agencies, clubs and members. And down the bottom, again looking at some of the key risks that will need to be considered. Focus Area 2 is about alcohol cultural change. Applicants will need to consider developing and implementing a sustainable alcohol policy and ensuing activities, facilitating member clubs to enhance access to reduce alcohol content beverages, developing strategies to reduce economic dependence of state sporting associations and their member clubs on alcohol revenue, and working in partnership with an evaluation team to document the achievements made and barriers faced. So you'll need to, through this process, you'll need to understand the way alcohol is supplied and sold, consumed and promoted within your SSA and affiliates clubs, before you can really start to develop an alcohol policy and strategies to implement alcohol cultural change. You might want to consider also conducting trials to assess the economic impact of selling and consuming mid-strength or light alcohol beverages on revenue and profit. What will you need to do and complete if you're applying to Focus Area 2? You'll need to complete the application form, which is available online. You'll need to fill in the milestone template specifically related to alcohol. You'll also need to complete the budget template, again specifically related to alcohol, and attach your key documents. So an alcohol cultural change program overview may look like this. Year 1, the planning phase is about establishing an alcohol reference group and review the current alcohol policy. And you might want to develop a trial for the implementation. In the implementation, you may consider a geographical zone, and you might want to think about rolling it out in metropolitan Melbourne. Consider the participation impact that this is going to have across all operations. Consider the monitoring and evaluation. Again, is it through surveys or face-to-face? Is it qualitative or quantitative? Stakeholders, who are the members, the local government perhaps, and having a good chat to good sports and so forth. Risks. One of the big risks that you will need to consider at the outset is the clubs embracing or not committed to the project. Or maybe it's about volunteers that don't understand the reasons why this program or project would benefit them, about bringing about a healthy sporting environment. As has previously been mentioned, support agencies and contractors will be engaged throughout this program. There will be support for each priority population. Vic Health will shortly circulate tender documentation whereby we'll be seeking expressions of interest from peak agencies to work with us over the next 3 years to review your work plans, to understand the population groups, to build relationships with critical stakeholders, and also monitor and evaluate the program and project specific outcomes. As I've already mentioned before, there are also a range of different contractors that are available, and I would highly recommend that, depending on your need, that you make contact with them in a timely manner and follow up with a conversation about how they might be able to engage with your organisation and provide you with some technical advice and expertise throughout the life of your project. So post June 30, 2011, state sporting associations, unsuccessful ones, will receive 3 months of pro rata funding to complete their existing Pixar projects. Successful SSAs will commence the new program come 1st of July. There are a range of resources that are available on the Vic Health website, and we would encourage you to familiarise yourself with these if you haven't already done so. There's a participation in physical activity research summary, the Building Health Through Sport Vic Health Action Plan, which highlights the strategic objectives specifically related to physical activity, and a range of different case studies from projects and programs under the Pixar banner over the past few years. So what are some of the critical timelines? Applications will open 5 PM on Friday the 11th of February 2011, while applications will close 4 PM Thursday the 23rd of March 2011. Notification of interview, if required, will be conducted in April, so should Vic Health seek further information about project scope, methodology, then we may interview state sporting associations. We envisage that applicants will be notified of the success of their applications or otherwise by late April. For further information, please be referred to the Vic Health website at www.vichealth.vic.gov.au. If you have any questions at all, please email your questions directly to ssapp@vichealth.vic.gov.au. Frequently asked questions are available on the Vic Health website and will be updated as needed.